My name is Troy Reyna. I'm a pediatric surgeon at CHOC Children's Hospital, and we're going to talk about umbilical hernias. Umbilical hernias are one of the more common hernias that we see, and patients are brought to us usually at all ages because the umbilical hernia is usually present at birth in about 10 to 15% of children. Some umbilical hernias or protrusions from the umbilicus or the belly button or a navel hernia can be relatively small or relatively large. It's the larger ones that really concern parents because, especially in infants, if they're crying because they have gas or colic or bearing down to have a bowel movement, the hernia can become relatively large and very taut and tense. And some parents will think that perhaps the umbilical hernia might explode or the child is in pain, and it's really not the case. That usually the umbilical hernia gets larger and smaller with any kind of effort on the baby's part, or if they're just irritable. And it's not usually the hernia that makes them irritable, it's some other cause, like feed me, change my diaper, or I'm having gas. When we do see them in the office, at whichever age, we tell them that most umbilical hernias will close on their own by age 2. When I say most, I'm talking about 75 to 80%. And the factor that contributes to the umbilical hernia closing is the baby is developing and growing during this time. As an infant, they learn to roll over, they learn to crawl, they learn to stand up, and they learn to walk. And doing this, they are developing their anti-gravity muscles, the rectus abdominal muscles that are the muscles that participate in the closure of the umbilical ring.